Okay, let's just do that. Hello, we are the IPTS Section C, Team 6, Group A. It consists of Kathleen, Maggie, Mick, Magdalene, Samantha, Courtney, and Spencer.
From February 2020 through November 2021, the United States Bureau of Labor Statistics reports a loss of approximately 500,000 healthcare workers. With an increased need for medical services, healthcare workers are experiencing significant levels of stress, mental health challenges, and fatigue. Healthcare worker shortages continue to be a great concern and often lead to the inability to staff beds, the higher potential for medical error, and higher financial and cultural strain on healthcare organizations. The COVID-19 pandemic in the US had an even more significant impact on healthcare workers that identify as Black, Indigenous, and people of color. It was found that these marginalized groups suffered higher rates of morbidity and mortality throughout the pandemic, leading to an increase of stress and isolation within these communities. The Hope Commission is a transformative effort to build a culture of well-being, inclusivity, and equitable outcomes for patients, healthcare workers, and the community.
So one of our tasks was to explore radical belonging and define it. The article defined it as a framework that emphasizes social, academic, and democratic belonging and the relationships between them for students in color in particular. We kind of redefine this as the integration of all individuals into a community where there is a universal acceptance in social, academic, and democratic settings. To summarize our learning, radical belonging is necessary for equitable opportunities in social, academic, and community environments. Why this is important, especially in healthcare, is to allow for effective communication and trust, reduce the hierarchical nature of healthcare, and increase employee and patient satisfaction.
So we decided to create some recommendation points in order to implement this into the hospitals post-COVID by focusing on creating an inclusive environment centered around organization, teamwork, and individual strides to strengthen the core of the organization. So a lot of things that we could work on is creating beneficial opportunities for existing employees, as well as openings for new hires to have an adequate amount of qualified staff. This just kind of ensures that every staff member feels that they are satisfied with the way that their job is going, as well as creating a safe environment for themselves and the patients that they're working with, as well as ensuring appropriate resources that are available to existing and new staff, such as insurance coverage, PTO, childcare, and counseling. This just allows for a better morale around having said job and enticing the new knowledgeable staff members that they probably need to update their staff. As well as this, we would provide diversity and inclusion training as a base of the organization to promote a safe environment, again, for all staff and patients. Organize teams within the units or specialties to create individualized goals that can be assessed by their peers, leaders, and individuals themselves. This includes having scheduled meetings within these teams on a regular basis to alter goals or methods of achieving them. From a psychosocial perspective, these can also touch base on provider experiencing COVID in and out of the hospitals, just to see where they are in their psychological beings. With the above, also allow for ideas from the individual staff members to be offered to administration based on their personal beliefs and experiences. If something is not working or could flow better in their individual floors or specialties, this allows for these recommendations for these staff members experiencing it firsthand. In addition to the advances in staff, create resources for patients and their families to easily access information about their individual needs or diagnosis, and information over the COVID hospital outcomes to reduce excessive times explaining by all the busy staff members.
So kind of picking off of making sure that we're creating resources for not only the staff, but the patients as well. Some of the key implementations that we were thinking of was providing COVID vaccines or just education on these vaccines, just allowing ample chances for patients to not only be vaccinated and be educated on the vaccines, but also visiting these pharmacies that might be locally around them if they are dealing with any other chronic illnesses, getting a bit of a introduction to the pharmacy might reduce some type of anxiety that they might have around hospitals or just healthcare settings in general. Offering support groups and individual therapists for healthcare workers, allowing them to feel like there is a safe space if they are not feeling okay. They're open and able to share their concerns and maybe work on what we can do better in order to reduce anxieties. Also providing information to patients on mental health resources, incorporating their mental health in their plan of care as well is important. Offering areas where people can quarantine, maybe even partnering up with other community orgs and making a list that we could send to those patients, just because the best way to support patients is throughout the community and being around other people in a safe way, of course. And not only are you allowing other community members to get together, but that also allows some type of networking that the patient might not have been exposed to. And it also, again, creates a safe space for that patient and their family. Promoting social workers in the hospital and aiding them as much as possible. Just overall working closely with local hospitals, other organizations, and staff to ensure clean and efficient transfers of care. We want to, at the end of the day, stop the spread, so that is just as important. And lastly, education for folks who are dealing with long-term effects of COVID. As you know, it's been a little bit more prevalent. There's been a more of a prevalent number in those cases, and letting patients and community members know about support groups and resources, and overall just educating them, maybe showing signs and symptoms of long-term COVID, like what we've been seeing, because knowledge is power. And then we wanted to make some considerations with the equitable impact of COVID on marginalized communities. So, understanding that many of these people are unfortunately lacking discretion and just overall autonomy of themselves or their families. And this could look like different options, such as, minimal options for treatment due to financial hardships, or overall lacking information, not being able to be around their loved ones when they're in a setting where certain family can be in there. For example, like same-sex couples in some states are not allowed, their spouse might not be allowed in the room, stuff like that. Or just even incarcerated patients, and they're lacking of space for quarantining in their cells. So not only making sure that we're treating them like people and, giving them information, but also, acknowledging some of their struggles that sometimes us healthcare workers might not see externally. And while we know that financial hardships are of a big concern, at the end of the day, being an access point for information is just as important, because it doesn't only have to do with your body or anything like that, but just like the intersectionality of health and society, just because we've seen even in 2020 a lot of people were facing loneliness, and you would sense that they would get a little bit more sick. So just really emphasizing the fact that education and just giving them access points of that education throughout treatment.
So in terms of kind of measuring the success and effects of strengthening the core of the healthcare organization post-COVID, there's kind of two different angles we're going with sort of measuring that, in terms of the direct outsourcing of the hospital and the organization itself, and then also the way that the overall employees and patients, like or clientele of the hospital, feel about the environment. So we kind of started with the frequency of hospitalizations for people who have tested positive for COVID post 10-day incubation period, the rate of admissions for hospital employees and patients staying at the hospital getting COVID, and hospital bed availability as kind of in terms of that outsourcing directly from the hospital. And then other ways is like kind of assessing the overall feeling of the staff and clientele. So how are you feeling with, do you feel like you are equipped with the best possible resources to provide the most efficient care? Do you fully understand your role as an employee here? Do you feel like you're fully included in all activities, all decisions being made? And do you feel like you're appreciated? And then in terms of patients, are you feeling like you're discharged from the hospital with the proper resources to continue living a happy, healthy lifestyle after recovering from COVID? And are you being discharged in a timely manner that you feel is efficient for your benefit in the future? And then obviously following the current guidelines of the CDC in of COVID-19 and kind of relating that back to how the hospital handles that and their protocol in terms of their outcomes and success.
So we've heard a lot of great ideas so far, but how do we ensure that these are sustainable and they can now operate at a larger scale? So one idea would be to ensure that there's a written plan of the system outlining all the details so that when a new onboarding staff comes on, it has all the explanation and they can go on without any questions. And also this can be extended to other healthcare institutions so it can be reproduced further there, again, without having any question on how the plan would be operated. We can also create a new position, and this staff member would be dedicated to the sole oversight of these implementations. That way they can understand and see how these processes work, and they can iron out any kinks. And this would include having yearly meetings for the new workforce to continue to address this topic. Another idea would be to involve the surrounding community, and this would be to one example would be providing a platform that is easy to access so that any community member can have feedback and they can express any concerns or ideas that they have and they can be implemented. We can also incorporate other organizations and other healthcare institutions within the surrounding community that would thus lessen the burden. And going from that, we can also, that can be a two-way communicative street and we can hear what they say. And that would then open more avenues so we can ensure that this is sustainable and it can operate at a large scale.
So within the final thoughts, we have some effective teamwork. So what things worked for our group, which versus which didn't. We feel that because the IPTS sessions were so spread out, it was a little bit harder for us to completely form a thought and put it all together at different timeframes versus just doing it all in one time frame. However, we did feel that what worked best was having that effective teamwork where we made a group meet and had a lot of those communications go throughout the same effective method that we used throughout the entire thing. So that was effectively what worked for us.
And another way that we could improve our communication strategy as a team moving forward is we talked about maybe taking a little bit more advantage of the time we had in class on Zoom, just to discuss the project periodically, just because, again, we didn't really meet that often, and kind of taking that advantage of that in-person time to avoid any miscommunication with our roles and just like solidifying the expectations of the project.
And then how can we show interprofessional cooperation moving forward? We kind of talked about how we can continue. I mean, we have each other's contacts now. So if we need to ask questions about other professions that, and we think someone from our group has insight on that, to not be afraid to reach out and kind of work together, continue working together as a team, because that's what this class is all about.
And then Mick is going to discuss how it is important to address burnout in the workplace.
Yeah, it's important to address burnout in the workplace in the sense that it helps reduce the number of errors made, as well as allows healthcare systems and innovation and collaboration among the other team members. Keeps everything nice and efficient, and make sure you're making the most use of everyone's time.
And also just some general thoughts and reflections on how COVID-19 has affected us. One thing that I thought of, or that we thought of, was reflecting back on the priority list of who got vaccinations for COVID first. I remember when they first came out, they rolled out and there's priorities for the attendings and then the residents and then the M4s, M3s, M2s, M1s. And that kind of just really solidified kind of the hierarchy within that, and might not have been the best situation, but even though they were on the front line, but it did kind of solidify that hierarchy.
And also, lastly, just getting the last few points. With online learning, as someone who was tutoring children during the first lockdown, the online learning experience for them decreased focus and overall retention of information. And so understanding that with those students that are, missing out on that year of, in-person learning, realizing that they might have a bit more educational difficulties and might need a little bit more time than like what we would expect students that were not doing online learning for a year. Overall, just less exposure, to go on to a different point, just talking about less exposure to different areas of medicine in our clinical experience. Many of us, like healthcare students, were not allowed to do clinicals in person, or if it was limited, and doing online learning essentially at that part as well was not ideal. So understanding that might affect our way of perception throughout healthcare. And last but not least, the overall lack of personalization of facial expressions is just lost behind the mask, because you're not able to show it within your face. So having that as a consideration and being able to work around that and making sure that we are putting in different physical cues that show positive feedback.
We just wanted to say thank you for listening to our presentation, and please let us know if you have any further questions or comments.